The biggest piece of advice that we have found really helpful is knowing what resources are available in your community. You've got to get to know what connections you can make in the community, great communication with those partners, because if we'll put the patient at the center and really surround them with those resources, then the patients thrive. They get the individualized care that they need, and they have better outcomes, which makes for a healthier community.
Any advice that I could give would include increasing your awareness about your own situation. Where are your patients at? What are some of those primary challenges that your unique population has? Every rural area is not going to have the same challenges that my rural area has, but you're going to have to know where your patients are going to the hospital. Are they having urgent care options? Is access to care the primary problem, or is it something more related to the social determinants of health? Do you have a high school that has a high dropout rate? And it's things that you don't typically think about as the primary care doctor's office or as the hospital, but it's the things that are going to be the drivers for where you need to add staffing or resources, or think about other options outside the box. So that would be my biggest advice, is increasing your own awareness of your own situation.
Our advice for any healthcare organization that is serving rural patients would be to build trusting relationships with those patients. Also, to know your community resources so that you can help patients get what they need for better outcomes. We also recommend having collaboration between your hospitals, your provider offices, and that community resource to help identify and knock down any barriers to care that a patient may have. Our system has a health navigation team that is dedicated to our providers' primary care offices that follows our patients and builds those trust and relationships over time in order to help us identify any barriers.
In rural health, risk factors such as being isolated in different geographical areas, being at risk for low life expectancies, or having limited access to job opportunities, being low income, this puts these patients at very high risk for mortality and morbidity. So by going to a value-based care model, we can have wraparound service for these patients to help meet their needs and better care for them. And that in turn promotes better health outcomes for our patients. So value-based care does not just help patients, it helps providers, it helps our communities. If we can prevent a problem before it even starts, that's key when it comes to better healthcare outcomes.